Hello, Facebook friends. This is Dr. Steve Weiner from the Aesthetic Clinique in Santa Rosa Beach, Florida. And what we're going to show you today is Dysport injections into the frown line. Squeeze that for me. See? That helps the frown line. It's a muscle relaxer. And then it also helps with the forehead lines. Raise that. So we're going to inject up here as well. So this is an injection just like Botox. We do 5 injections in this area, one here, one here, one here, and here and here, and that helps weaken this muscle right here. There's a muscle called the corrugator, which is this muscle right here, and there's another muscle called the procerus, which goes from here to here, and that causes the wrinkles that go that way. And then there's a muscle called the frontalis, and that lifts the eyebrows and causes these creases in the forehead. Now, for some people, these creases are caused by too low or too heavy a brow, and so they lift it up to help get rid of the heaviness in their brow. So some people have really deep creases, but you don't want to inject those deep creases in everyone, because oftentimes if you do, they'll get lower brows. So in a healthy young person like her, we can inject this area as long as you got to make sure that you don't start off with heavy brows, because this is a muscle that helps lift the brow. So anyway, that's a common mistake by early injectors, and you have to just recognize the patient before you inject. You don't want to inject too much up here. So I've been injecting Botox since 1994, and Dysport since it was FDA approved. I think it was in 2007 or so. And I actually inject a lot more Dysport these days than I do Botox, about 3 to 1. And there isn't much difference between Botox and Dysport, except Dysport seems to kick in maybe 24 or 36 hours earlier than Botox. So when you inject it, in about 2 days, in some people, you start to see the effects. In Botox, it's maybe 3 days. And then, anyways, in about 7 to 10 days, the full effect of the Dysport or the Botox is you can see. And that will last you for approximately 3 to 4 months in most people. So you need to get re-injected every 3 or 4 months. The thing that some people come to me and I try to explain is if there are wrinkles at rest, those aren't always improved with Dysport or Botox. Those are called etched in lines or wrinkles at rest. Over time, if you repeatedly do the injections, they will flatten out. But if you can see these wrinkles at rest and you pull it apart like that and you still see the wrinkles, those are etched in lines. And those are harder to treat. They're almost like scars. She doesn't have them. Botox is mainly used for treating the wrinkles with movement. So areas that we commonly inject are the glabella and the forehead. We also do brow lifts with Botox. We inject over here. You do the crow's feet, and you do the bunnies, which are these. Show us your bunnies. See, you can inject these bunny lines. You can also inject around the lips for the lip lines. It's usually best to do that in combination with fillers. We inject the masseter muscle, which is this muscle right here. And that's a muscle that causes widening of the face when it's enlarged. And oftentimes those people are ones that grind their teeth. And it can also, if these muscles are enlarged, lead to TMJ. So since 1994, I've actually also been injecting this masseter muscle to relieve the tension in it. So particularly in Asian patients, it's very popular there. They get a widening of this lower face. And if you inject that masseter muscle, it actually slims the face up. It's actually a great procedure. And it gives people relief from the tension that's associated with TMJ. Another area we inject is called the DAO muscle, depressor angularis oris, which is right in here. And that's a muscle that, when active, causes the downturn of the corners of the lip. When you inject it, you release that muscle and it brings the corners of the lip upward. Another area we inject Dysport or Botox is for the gummy smile. So when people smile, some people show a lot of their gums. Not Hannah, but some people. And there's a way to inject right in these areas to lower that muscle, lower the lip, I'm sorry, to weaken that muscle so you don't smile quite as big and you only show the teeth and not the gums. So that's a great area as well. So some people get crinkling of their chin, called an orange chin or a walnut chin, and you can weaken that by injections right here. One other area we inject is right in here. There's a muscle called the platysmal muscle, which is this muscle of the neck, and it runs into the face. And sometimes when it's too strong, it causes a little bit of jowling, and it's pulling down on the jawline. So if you weaken it, you get a more firm jawline. That's called the Nefertiti lift. Another thing that we inject are actually the platysmal bands. Can you show us your bands? See these bands right here and right here? So those are active in some people, and they're very strong, and we can weaken those. Now, some people have them right here, and even at rest, and they're not very strong, and it's not going to work on those patients. But the patients that talk and they have very strong muscles here, it's a great treatment for that. So I think I've told you about everything that we treat with the Dysport and Botox. So let's go get started right up here. We've already cleaned her off with the alcohol. And so you can stay right there. So the first treatment right here is the procerus muscle, and I put 5 units right there. Then this is the medial head of the corrugator, and we treat it right here. And we do the same thing to the other side. So 5 units. I'm sorry, that's 10 units. 10 units, 10 units, 10 units. I'm thinking about Botox. So here's another 10 units. This is the lateral part of the corrugator muscle. And then here's another part of the lateral corrugator muscle. So I told you about brow raising. This reminds me, some people have inner brows that are too low. And you could inject this area right here, which is the DLI, depressor supercilii muscle, which is right in here, right in here. And that will raise the inner brows. So that's another unique technique to help that. So let's go on to the forehead. Now Hannah likes to maintain a lot of her expression. So we inject this very lightly in Hannah. And actually, all my injections in these areas are usually so that you have decreased movement, but you still have movement. It's actually a little harder to do. To absolutely have no movement is no longer what's norm, and we like to do it so that there is some movement. So raise a little bit. So okay, so relax. So I put in approximately 2 units across the forehead here in these areas. And you're going to get a little bleeding sometimes. And so there's 2 units, and then here's the final 2 units. So we put in a total of 10 units up there. And that's about it. That's your treatment for Dysport, forehead and glabella. And she's very young, so she doesn't need it in her crow's feet or any of the other areas I discussed. And so she'll have bumps in these areas for about 15 minutes, and then they get absorbed. What we do is what we ask patients not to do for the first 2 to 3 hours is no strenuous activity, no sweating, no hot tubs, jacuzzis, or saunas, because the thinking there is that we don't want a lot of heat in this area, particularly sweating and so forth, because that could cause movement of the Dysport. But after that amount of time, you're free to do any type of activity you want. The other thing we do is we tell you not to get a massage with your head down in a horseshoe, because that will also possibly move the Dysport around. And then after it kicks in 10 days, if you want me to take a look at it, because something is still moving or a little more than you want, you should just come on in and we do some touch-ups for that. But this is a very easy procedure, quite painless and actually very quick, as you can see, and very high satisfaction rates, well into the high 90 percentile. And I'm one of the top 100 injectors in the country, according to Galderma Dysports. They've awarded me with that. And I'm in one of the top 1% in the country as far as volume goes, as far as Dysport and Sculptra and Restylane. So please give us a call if you want some more information at 850-622-1214. Thank you.